At a community medical clinic in urban Washington, 11-year-old Catherine is visiting the doctor. Her working-class family relies on Medicaid, a government medical program for low-income Americans, to pay for her visit. But Medicaid is just one of the programs President Obama says will face cuts as part of a deal being made with Congress to reduce government spending and raise the U.S. debt limit. He calls it
a tough package that includes both spending cuts, modifications to Social Security, Medicaid, and Medicare.
More than half of Medicaid recipients in the United States come from ethnic minority communities. That means cuts to Medicaid and other government social programs will have a devastating impact and further sideline those who are already struggling.
Bottom line is we're going to have more people coming in sicker. And for the elderly, we're going to get elderly whose diseases, diabetes, hypertension, is going to get worse and worse.
On Capitol Hill, members of Congress from the Hispanic, Asian, and Black caucuses called attention to the problem.
We know that there are discussions that could very well impact the beneficiaries of the most important programs that the federal government has to offer all Americans. Unfortunately, there could be a disproportionate impact on communities of color.
The U.S. faces an August 2nd deadline to raise the country's $14.3 trillion debt limit, or it defaults on its payments for the first time in history. And partisan disagreements over whether to raise taxes and cut social programs remains the main obstacle.
Really dealing with a situation where there's a lot of political gamesmanship when it comes to the national debt ceiling. Those who are most vulnerable, who are least likely to have a dog in the political fight, are the ones who are going to be most affected.
And in this case, it seems, can least afford it. Kimberly Halkett, Al Jazeera, Washington.